All right. Well, hello everyone. Thanks for joining us today. Our title today, or theme of today's educational seminar, is about collaboration with community and parents. Um, so, Today we'll go over kind of an overview of the different stressors that school wellness. Hold on. Joy, can you click through? There you go. Um, Kind of an overview of the stressors and challenges that school wellness counselors do face. And then also then the importance of collaboration to kind of ease the burden on the different wellness professionals. We'll talk about how to do that, like tips and ways to kind of keep your community referrals and parents engaged. And then we'll also just sort of spend a little bit of time talking about tips and strategies to reduce your own burnout and well-being, because again, this is a really tough job that we're all in. So some of this is nationwide, but I know some of these challenges are like especially different and unique in Orange County and in private school settings. But overall, I think we all know we're seeing a worsening of mental health in teenagers. So that just probably means larger caseloads for school counselors. Everyone's kind of feeling the burden of long wait lists. Obviously challenging parents. And I know, again, some of this is especially unique in our socioeconomic area here in Orange County. But a lot of times parents can come in really defensive or litigious. And again, those things can be really challenging and take away from the actual work that we're trying to do with the students. I'm sure a lot of schools are too familiar with just administrative challenges that, again, that are slightly different in each private school because they're just a little less standardized than maybe the public school setting where our system is in place for a lot of these things. And then just a limited access to resources. I know we're going to talk about how important it is to, utilize your community and refer out when needed. But we also know that a lot of community referrals are hard to come by, and there are long wait lists everywhere. So all of these things really do lead to high levels of burnout. And so I'll talk a little bit more about burnout on the next slide here. It's basically, it's characterized by these three things: physical and emotional exhaustion, when you start to feel cynical and detached with your work, and you just sort of feel ineffective and that you're not accomplishing much. And besides just impacting your quality of life, burnout really does kind of limit your value at your office because you cannot be as effective as you want to be. And we know some of the risk factors of burnout. And I will say, wellness professionals and school faculty in general experience twice the level of burnout nationwide compared to most other professions. So anyone in the helping profession is kind of at a high risk, but also the schools make you high risk too for these kind of these feelings. So it's just really important to kind of be mindful of this stuff. So risk factors include a lack of control. So when you feel like you can't practice the way you want to practice or do what you want to do, because whether it's administrative challenges, parents getting in the way, or just like not knowing who to turn to for supervision or professional consultation. When your job expectations are not clear. And again, I know some of these schools, like as the mental health issues are growing, schools are trying to keep up and catch up and figure out their plans and what to do to support all of these needs. So sometimes that can leave expectations for what your role is really unclear, and that can be challenging and lead to burnout. A mismatch in values, and I'm going to talk more about this later, so I'll kind of just leave it at that for now. Again, we also know with the worsening mental health crisis, kids are presenting now with pretty serious clinical disorders like eating disorders or personality disorders and things that might feel outside of your current training or scope of practice. And so that can also leave you feeling overwhelmed and burnt out. And then just in general, just a lack of social support or work-life imbalance will obviously lead to feeling burnt out. So to kind of alleviate some of the burden of the work that you're doing, we wanted it to kind of really stress the importance of collaborating and really using parents and outside providers, again, to sort of like share the burden of the work, but also to kind of make your work feel more meaningful, more useful, and more productive. So, in the medical setting, they've developed this collaborative care model, and it's actually it's shown to be very good in kind of improving the outcomes of people who have mental health issues. And so, it started basically by treating more people who have mental health issues in primary care. And so we know that most people go to their primary care doctor for everything and they start there. And then what happens is the primary care started saying, like, let's consult with mental health professionals. So they would bring in outside um, psychiatrists or other, mental health therapists and case managers, and they would deliver healthcare, mental health care kind of through the primary care setting and then monitor progress over time. And they found that when everyone was on the same page, collaborating, and the kind of the PCP normalized mental health care, people were a lot more likely to receive the care that they needed. They limited a lot of access barriers, and it just provided great outcomes altogether. So there's some preliminary, studies that show that they're trying to adopt this in school settings. But almost, if you guys think of yourselves as the school staff as a PCP office, you're getting frequent contact with these kids, like way more than outside providers or even parents, and you have multiple vantage points, right? You have that, from the teachers, how they're doing with peers, how they do with authority, so you get, and you just see them every day. And so I think you're in a really valuable position to kind of normalize mental health care and help communicate between all the different, people involved in the lives of your students. Um, so a big thing that I think schools are coming to us and asking about is, how do we just engage the parents? I know parents, there's probably a range. Some are too involved and some are not involved. And sometimes it's the ones that are not involved at all that need to be involved, right? And so, um, just as a general thing, instead of waiting until there's a crisis, make yourself known to parents, whether it's like introducing at the beginning of the year or, at certain time points, just introduce yourself, let them know who you are, what your services are. Um, Frame it as a very positive thing. Sometimes people think like, oh, when the school counselor is involved, it's like going to the principal's office, right? Like, it's only a problem, versus you're there to be proactive in providing tools and tips and strategies. So if you have that kind of positive history of interactions with families, they're more likely to be receptive when you step in or intervene if there is a problem or crisis that pops up. It's also good to keep in mind that a lot of students and parents have not had positive experiences in the past. And so they might come across as defensive. So just kind of be aware of that and be mindful of that. Um, Other things that other schools have done are like sending out a newsletter with resources, basic tips, education. Again, it's just other touch points where people are understanding that this stuff is valuable. You're normalizing it, destigmatizing it, and again, they're putting kind of a face to a name, or a face to a service that's available to them, and they're more likely to um, kind of receive it and welcome meetings with you if something comes up. And then, of course, hosting any kind of wellness event for parents or families to talk about these things. Again, I know these things are challenging within each different school, but all of these things kind of, again, normalize what your role is in the school administration. And then in terms of collaborating, once the patient or once the student is already on your client load, that those previous strategies are just kind of like to get parents involved in general. But once you're working with an identified student and you have to work with the families, just remain curious and open. Again, some parents are very insightful and aware, and they know what's going on and they are actively seeking support, and others may be completely surprised. So really ask those open-ended questions. Ask if it's okay to share what the school is noticing, get their permission. And again, approaching it from a place of curiosity and respect can go a long way in reducing people's defensiveness. Normalize that their reactions are okay if they're afraid, or if they don't know what you're talking about, or they're not viewing the same things. And you just want to communicate that we're all on the same page, so communicate those shared goals. Also, again, highlight positives before really going into the problems. Again, and it kind of feeding back to that last point I made on the last slide is if you have a history of positive interactions, hearing some, some feedback is a lot easier for parents. And then focus on solution building. So we're going to talk again throughout this presentation on resources and things um, outside of school as well, but be open and honest with parents too about those things and normalize that sometimes it's okay to step outside and get help from different professionals. And then so once you do decide we're going to refer outside for this, just make sure if you are handing out a list or if you have, some referrals that you're going to give out, it's good to know the people you're referring to, right? And so if you are going to refer to, so and so doctor, make sure you know that doctor and how they practice so you can kind of, educate the family or give them a heads up on what they might expect, and highlight that importance of collaboration at the outside so that they just know it's best, best care to talk and make sure that everyone's on the same page. And then educate them on confidentiality issues. A lot of people, I'm not sure how much you experience it at school, but a lot of times when we get referrals from school, the referral may come from school and then the parents are refusing to sign release for us to communicate with school because they're afraid. They don't know what's going to be shared. And, they're worried about confidentiality and privacy and how it's going to affect their students. Not only just reputation, but does this go on their record or anything like that? So the more you can really concretely educate them on what is being shared, that it's usually just brief treatment updates. We don't go into all the nitty gritty details of anything personal. They're more likely to be on board with that. Also, again, as you're providing that referral, it's usually good practice to just sign the release of information right away. So that way it's taken care of. And again, it's done more in a, here we're being proactive about this. We just want to have open communication versus when there's a crisis. Oh no, quick, let's sign so we can talk to this person, right? And I think it's always received a little bit more. It's just received better when you do it at the outset. Let's see. I think I kind of went over all of this stuff, but again, just using destigmatizing language is always a good idea because again, some families are a little bit more resistant to this stuff. Just to kind of touch base to when to refer to an outside provider, generally speaking, if your school-based supports if everything is in place and everything that you're able to provide at the school is not enough, right? So the kids are still having problems with attendance or tardiness or not turning their work in, or you seeing the mood changes, and or if their diagnoses or symptoms are at the clinical level, meaning it's outside of the scope of what the school can provide and they need, more specialized care, that's a good sign to refer to someone else outside of the school. And so then when you're when you're collaborating with the mental health providers, again, make sure you have that contact information right away because sometimes families don't always have it, or there's just a lag when we're waiting for families to provide it. If it's someone you have not referred, but you know that the student is working with an outside provider, then you can ask the provider or, ask the families to provide that information for you, request a release of information. And again, go ahead and call and introduce, even if you don't think you have too much to share, just kind of make a touch point, introduce yourself, say, hey, I'm working with a student, I would love to collaborate, or, I would love to tell you what we're noticing at school if you think it would be helpful for your work. And then you can kind of decide together what makes sense moving forward. So I've had some families where I work very closely with the school counselors or the teachers, and we are regularly in contact making plans for the specific student. And then I have some where it's like, okay, you do this part and you focus on the academic and I will focus on the mental health, and we kind of tag team. Or some people are like, this really doesn't affect us at school that much, we'll let you know if it is affecting school, but otherwise we're just happy we've connected them with someone who can deal with these issues, and that's the end. So I think that conversation is important to have just so that and then also again just so that you're on the same page, because kids are coming in with anxiety and the parents are like, oh, well, the therapist told you us to do this and this and this, and you're not hearing it kind of directly from the horse's mouth. We just want to make sure that we're all communicating the same thing and not making situations worse or reinforcing things we don't want to reinforce.
Andrea, can I add something to that? Because I think
Yeah.
that is an incredibly important point. I can say from my experience, parents, if they trust that you are making decisions that are or are going to attempt to make decisions that are in the best interest of their kids, they want you to communicate with outside providers. I always try to convince people we're really all on the same team when it comes to kids. I use that analogy for divorced parents a lot, is we've got to remember we're on the same team. I realize everything's complicated, but if they trust that you're going to try to make decisions in the best interest of their kid or in support of their kid, more often than not, they'll sign consent, which is incredibly important, because if they don't, and we don't have any information from the school, then we really just get information that is filtered in through the lens of the parents or that child. And a lot of times we don't get to see the full picture. And from my experience, most good mental health professionals feel like they're advocates for their patients. So then we're going to default to this mode where we advocate for them without having a full picture. And, we can always receive information. So hopefully the parents sign consent. But even when they don't, you can always leave a message. You can always send an email. We can always receive information. And the more information, the better. Most of the time.
Right. So I'm going to shift a little bit just to talk about strategies to reduce burnout for wellness professionals, and um, a lot of this too. I know we practice, we preach this all the time, but we're not really good at practicing what we preach. I know I'm for sure guilty of that. So, in general, when you're feeling burnt out, you're more likely to doubt yourself and not treat yourself as well. So, just going back to the basics of, you know good food, exercise, like getting enough sleep, all those like self care things that tend to go to the wayside when we're in high stress situations. Be really mindful of that. And self compassion. Again, this is a really hard job being in a helping profession where, again, a lot of the variables can sometimes feel stacked against you. The more that you kind of, again, have the same compassion to yourself towards yourself that you would have to someone that you're working with, the more likely you are to sort of cope with all the challenges that come your way. I'm going to talk a little bit more about mindfulness on the next slide, but we also know the two evidence-based interventions that work really well for a range of mental health issues, but also for burnout, are cognitive behavioral therapy, or CBT, and acceptance and commitment therapy ACT. So CBT focuses on modifying those negative thoughts and behaviors that are contributing to distressing emotions or maintaining them. Um, and ACT is kind of like the new wave CBT, but it's like really focused on sorry, not so much changing those thoughts, but more accepting those thoughts and understanding that they're just part of our daily experience. And what we want to do is increase behaviors that are consistent with our values. So again, they both kind of deal with thoughts and behaviors, but in a slightly different way. So, kind of some common examples with CBT is, again, in high stress situations, we're naturally going to have more negative thoughts, and some of these thoughts can kind of maintain this feeling of being overwhelmed and stressed and burnt out, or feeling devalued. So, like an example, I'll never be able to reach this student. The more adaptive thought would be, well, the value of my work with this student may not always be evident. This parent is so demanding and unreasonable. Well, this parent is really concerned and fearful for her child and just may not know how to express or cope that, right? Again, you're switching it from feeling like a victim to feeling compassionate, and that's more likely to keep you recharged and going. No one understands what I'm dealing with work. And now you're all connected with this wonderful group of colleagues in this community here. So use your supports. And then again, mindfulness is, we see this everywhere. It's like the big buzzword all around wellness and psychology and stuff. But really, the core of it is being deeply engaged in your present and kind of just letting experiences and feelings be what they are without trying to, force them or change them, kind of like letting them come, observing them and letting them go, not over identifying with them. Um, and that can really help take the edge off when you're feeling overwhelmed. And then, uh, so some of the kind of core principles, so mindfulness is a big part of ACT, but so is cognitive fusion. And again, so CBT is really like, let's look at that thought, analyze it, change it, make it better. But sometimes that's not always helpful because those thoughts, especially if they're kind of intrusive and constant, it takes a little bit more of a gentle approach to thought. And instead of changing them, we just want to change our relationship with them. So instead of, again, thoughts being absolute facts and truths that have this power over us, we just recognize them as mental processes that come and go, and we kind of just let them be, without over identifying with them. And that can sometimes, again, ease our coping and ease our distress. And again, we've sort of just have this acceptance that distress and negative thoughts can sometimes be a normal part of our reality, especially when we're in high stress situations. And then just the kind of generally connecting back to what we think is important for us. We all kind of came into helping professions for a reason, and it's easy to forget that in the middle of all the stress and challenges and, crises that pop up on a day to day. So connecting back with those values and making sure that, you're setting the right boundaries and honoring what's important to you, again, makes life just a little bit easier. So I'll stop there because I want to make sure you guys have time for questions with us later. But thank you very much.
Thank you so much, Andrea. And I'm going to stop screen share just for a